Hello and welcome to Ask Dr. Chris. The topic of today's talk is varicose vein, and I would like to go through some of the questions that we've received over the past few weeks. So the very first question we have is, what are the symptoms of varicose vein and how do we identify that we have varicose vein? One of the most common symptoms that we see is swelling of both legs, usually later during the day or at night time. Also very common is soreness and pain in the legs. People talk about varicose vein being a manifestation of large veins in the leg, but those are actually very late symptoms. Swelling and pain comes first. By the time you have swollen prominent veins or spider veins, the process has progressed to stage 3 or 4. What are the most common reasons people suffer from varicose vein? Well, the number one factor is family history. It's been known that if one of your parents has a history of varicose vein, you have about 50 to 65% chance of having it. And if both parents have varicose vein, that risk is increased to 100%. Other risk factors that we know of includes obesity. Being overweight puts you at a risk for varicose vein. Being a smoker is also a risk for varicose vein. Another risk factor that we should be talking about is work-related risk factors. So people that work standing, like doctors, nurses, and all individuals whose job involves standing for a prolonged period of time will have at risk for varicose vein. When should you consider vein screening? If you have any of the symptoms that we talked about, which is swelling, soreness, prominent vein, or spider vein, I would strongly recommend that you call us for a very quick and very safe vein screening that usually takes about 5 to 10 minutes. What does this screening involve? It is essentially a face-to-face meeting with a provider, either myself or one of my team members. You will get a 10-question questionnaire, which is very easy to fill out. Secondly, a physical examination, which is the examination of your legs, looking at the veins, where they're most prominent, if there's any swelling, the location of the veins, what type of veins we're dealing with, is it varicose vein or spider vein, will help us significantly in determining the best treatment for you. The last phase of the screening examination is an ultrasound study to assess the reason behind the varicose vein. In entirety, this procedure, the evaluation, takes about 10 to 15 minutes. Number 6, what are the key factors that helps us to determine if a vein treatment is needed? Well, it depends on how severe the symptoms are. So if the symptoms that happen once in a while, maybe once in a blue moon, we recommend changes in lifestyle, such as wearing stockings or elevating your legs. However, if the symptoms are daily or they affect you on a more regular basis, affecting your quality of life, or you've had complications such as wound ulcers in the legs, we recommend immediate evaluation and treatment. What treatment can we offer for varicose vein? Depending on the severity of the disease and depending on how impactful it is on your life, treatments ranges from lifestyle changes such as wearing stockings, losing weight, avoiding high salt food, to injection therapy, as well as what we call laser or radiofrequency ablation of the vein. All of these options are available on our website. If you have any additional questions or more details on this, please go to georgiasurgicare.com for immediate access to our database. Next question, can compression stocking help with leg pain? Yes, but this is one of those questions where we all know that it's difficult to wear stockings in Georgia. Georgia is notorious for having a very warm weather, which we all love. Stockings do help, but they almost offer a band-aid treatment for the disease. They do help with swelling and a sense of heaviness that we have. However, for long-term solution, they do not treat the varicose vein. Number 9, is vein surgery covered by insurance? Yes, vein surgery is covered by all insurances, and as you know, we accept all insurance as well. Number 10, what does the operation or the procedure consist of? First of all, this is not a major operation. This is considered to be a minor procedure, taking about 15 to 20 minutes in total. It involves a degree of sedation, as well as using a small needle to access the vein and to essentially treat the vein from inside using a form of heat, either laser or radio frequency energy. In all, this takes about 15 to 20 minutes. Recovery is a couple of hours, and we encourage our patients to return to their daily regular lifestyle within 6 hours to 24 hours after the procedure. Can symptoms occur after vein surgery? Yes. People that have a strong family history of varicose vein, for example, whose parents suffered from varicose vein, do tend to have a higher risk of recurrence of the vein disease in other areas of the legs. So we recommend frequent screening. We recommend establishing a strong relationship with a vein specialist like us, where we can actually see you on a regular basis, even after the treatment is completed, maybe once a year, so we can scan and evaluate you for any other areas. As you know, when we treat this condition at an early stage, it is a lot easier and the treatment is more efficient if it's treated at an early stage rather than later. What are the risks involved with getting the vein treated? The procedure as well as the treatment plan is considered to be very, very benign and very safe. Even though complications have been written about in books, I can assure you that in our practice over the past 10 years, we have not had a single complication with this procedure, and I'm proud to vouch for the safety and the quality of this procedure. Difference between varicose veins and spider vein. Well, I consider varicose vein to be a progressive disease, and I consider this to be almost like a branches of a tree or the roots of a tree. So if you think about the tree trunk to be the big veins, and as you go into the root systems, the roots get thinner and thinner, and the most thin portion of the vein is called the spider vein. Once pressure builds up in the vein system, the first area where we'll see the pressure build up is in the spider veins, and subsequently we'll see them in the bigger veins. So essentially, these are manifestations of the same condition, just a lot more prominent in smaller veins at the beginning, followed by bigger veins at the end. How do I make an appointment? We have extensive opportunities for getting you into our office. We do have a 24-hour call center. We have text and phone and a website where we can capture information and get you scheduled within a few hours of your first contact. I would encourage you to call us at 678-466-6760 or visit us at georgiasurgical.com to schedule an appointment today. Also, do not forget to subscribe to our YouTube channel and follow us on Facebook and Instagram. Thank you.